update in the vaccine rollout. Johnson & Johnson is tossing out a batch of its COVID vaccine. That's after they revealed one of their manufacturing partners, Emergent Biosolutions, botched a 15 million batch due to human error. Here to discuss is Dr. Amesh Adalja, Johns Hopkins Center for Health Security Senior Scholar. Welcome, Doctor. So the optics on this are bad, but the safety protocols, essentially at the end of the day, they work because they caught this. What's your big picture take on what happened, and does this do any damage to the vaccine rollout?
I don't think this will do anything to the vaccine rollout time scale. I think we'll still get to the goals that we're going to get to. Johnson & Johnson has been able to deliver vaccine for March, and this is for future shipments, and we do have Moderna and Pfizer. But I think that the larger issue is that anytime there's a bad headline about these vaccines, it's going to add to vaccine hesitancy because people tend to forget the actual details of what the story was about, but they remember another glitch or a hang up with this vaccine. And I think that's the part where we have to really be proactive in trying to talk to people about the fact that there are multiple safety measures in place and human errors can occur when you're manufacturing something at such a large scale. And this was caught, and it's not really going to derail any of our plans to put this pandemic behind us through the use of this vaccine.
Yeah, that's certainly been a big concern among healthcare workers of people not wanting to go and get vaccinated because they're not sure if it's safe. Now that most states have expanded the pool of those who are eligible for these vaccines, how much of that hesitancy are we seeing, and what more do you think needs to be done from an education standpoint?
It's hard to know exactly what the hesitancy is going to look like when we get to a time when we're not supply constrained, when the vaccine is in plentiful supply. And I think that's going to be the case. But the issue is that we have to really do is be proactive and provide information to people. People are going to ask questions about a new vaccine. That's normal. We have to be able to give them trusted sources of information to look at the safety, to look at the efficacy of this vaccine. And I think that's the best thing we can do. We have to also reach out to populations that are more vaccine hesitant. For example, we're seeing conservative males being one group where they don't want to take the vaccine. So there have been specific campaigns aimed at them. So we just really have to set the tone of this debate, and the vaccines data speak for themselves. And I think we can really all we can do is really give people the data and meet their concerns where they are and try to answer them and hope that they'll make the right decision.
And Doctor, the other news we got on the vaccine front is Pfizer and BioNTech coming out and saying that essentially their vaccine has shown to be effective over the last 6 months. Of course, we're just still talking about the early days of seeing in real life what the efficacy is there. But what's your takeaway from the study, and what does it ultimately mean in terms of being able to get to herd immunity by summer?
You have to remember what we're doing are natural history studies. So we're following people who were vaccinated and looking at their antibodies, looking at their T cells, looking to see if they get reinfected. And I suspect 3 months from now, we'll read another study saying that the vaccine is effective for 9 months. It likely is going to be something that has some duration of immunity that maybe would be 1 year, 2 years. We don't quite know exactly where it is because we can't foretell the future. But I do think that this induces robust immunity, and we probably won't need boosters on a yearly basis. Maybe it'd be something more on a two-year basis or 5-year basis. It's hard to know exactly. But what we're seeing with all of this data is that these vaccines are tremendous and that the benefits of having this vaccine rollout are going to accrue. And I think we'll have to stay tuned to see exactly if we need to update the vaccines because of variants or if we need boosters to boost our immunity. But so far, everything is looking really good when it comes to these vaccines.
And Doctor, we've gotten a number of warnings this week as more and more people feel comfortable going out, states start to lift restrictions, that we are not out of the woods yet here. Dr. Fauci, of course, warning of the plateauing of the numbers. We heard the CDC director also talk about concerns. As you look at where the case count stands, where the hospitalization stands nationally, what's your biggest concern when you counter that with the lifting of restrictions?
So I'm somebody who thinks that this vaccine rollout was really geared to do 3 things: stop serious disease, hospitalization, and death from COVID-19. So that's already starting to happen. If you look at nursing home cases, nursing home deaths, if you look at national hospitalization numbers, they are low, they're going down in most places. And when you even look at places where there is an uptick, it's nowhere near what it was during the winter surge, for example. So I think what you're going to see is a decoupling of cases from severe disease and hospitalization. And we're going to have to start looking more at hospital capacity because this vaccine is really doing a great job. And as we roll out the vaccine into younger groups, those those who are getting infected now, we're going to see those benefits accrue. It's important for people to remember, however, that if they're not vaccinated right now, we're still in a pandemic. You still can get infected. You still can have a very hard time with this virus. So we need people to continue to wear masks and to continue to wash their hands a lot and try to avoid crowded places. As states increase capacity and reopen, the best way to do that in a safe manner is by making sure that people are still wearing masks and to accelerate your vaccination program.
And Doctor, finally, we're talking to you on opening day of baseball. And when you look at nationally what the capacity is, it really does vary. Over in Texas, of course, the Rangers have gone to 100% capacity in the stadium. The Astros going to 50%. The Rockies over in Denver at 40% capacity. And then you've got this news that just came down. The New York Mets, their season opener has been postponed because of COVID issues. What's the concern here is, to your point, more and more people feel comfortable going out there. Should we be concerned that stadiums are starting to fill up again?
If the stadiums are open and having fans there, and they have appropriate measures in place, social distancing, mask policies, trying to encourage vaccinated people to go there. But I don't know if every baseball fan is going to be vaccinated at this point. That's the way to make it safer. You can do this in a safe manner and you can do it in an unsafe manner. So it's really important that you get this right, because mass gatherings like that can be places where you can get a lot of cases and a lot of chains of transmission set off. So you want to make sure that you really have a policy in place that's going to reflect the fact that we're in a pandemic. And I think that's going to be different in each state. Each state is handling it differently, but people have to make smart choices and risk calculate. I think you can do a baseball game safely if people remain socially distant, if people wear their masks, if you're vaccinated. I think it's a much safer prospect to go to than if you're not vaccinated. But I think we're kind of in this limbo stage where the vaccine has given people a lot of hope, rightly so, to getting back on track. And we're not quite there yet because we haven't gotten the vaccine into those groups of the population that need it now because they're getting infected. So I think this will probably change over the next couple of weeks. We'll start to see a better environment in terms of cases and for gatherings like baseball games.
Yeah, a good word of caution there. Dr. Amesh Adalja, Johns Hopkins Center for Health Security, senior scholar there. It's always good to have you on the show. Thanks so much for your time.